This is the C4 and Brian Neiman podcast. C4 and Brian can be heard live every weekday, 5:30 to 10 a.m. on WBAL News Radio 1090, FM 101.5, and the WBAL app.
All right, our fifth town hall, as a matter of fact, the week before Thanksgiving, as we talk about COVID-19 and the ramifications and what to look out for. We are pleased to be joined now by Avery Wrigley. She's a nurse with GBMC. Great to have you on. We really appreciate you coming on and sharing your experience. And I guess that's really where I wanted to go first, and that is if you could give us, kind of what the day in the life of a nurse is right now with COVID and the number of cases going up all across the state, all across the country for that matter.
Sure. So thank you for having me and letting me share my story. Beginning in March, I was on the COVID-19 floor, and it's a 30-bed unit, and all 30 beds were occupied with COVID patients or patients under investigation for COVID. So from about March to July, we only had COVID patients. And then afterward, we got a break. We had our regular telemetry patients. And then starting in November, we started to get COVID patients again as the surge increased. And currently right now we have 20 out of 30 beds on our unit occupied with COVID patients.
Registered nurse Avery Wrigley is on board with us. She's with GBMC Healthcare. As you know, we have a partnership with GBMC Healthcare, the coronavirus, our town hall specials. And Avery, I read your 80 days with COVID-19. It is gripping to read what you experienced beginning on March 25th and going through June when you wrote that. My aunt was a registered nurse. She's passed away now, was a nurse. Just explain the role that you play significantly between the doctor and the patient. I mean, we see a lot of movies, but you are that connection between the doctor and patients.
Yeah, so at that time, us nurses, we actually felt like we were, that connection with everybody. We were doing a lot of respiratory treatments. We were doing a lot of our own blood draws. We were doing a lot of, speech and therapy and all of that, where normally we would have specialists helping us with that. But because of risk of exposure, we felt that it was better for us to do as much as we could. And it was a super challenging time. It was very, unprecedented and unplanned. And I think the anxiety that the patients had really connected us with them because we felt the same. So it was definitely challenging and stressful, but it was also, in a sense, it was a rewarding experience because we got to work with patients that we normally wouldn't, and we got to experience something that I can say personally I've never experienced in my career.
Do you get tested every day if you work in the COVID unit? Like, how does that work for employees?
So we do not get tested. As long as we don't have any active symptoms, we do not get tested. We wear our PPE all the time. We wear surgical masks in non-clinical areas, and then when we go into patient rooms, we wear N95s and face shields and gowns and gloves and all of that. So as long as we don't have any active symptoms of COVID, we do not get tested.
Nurse Avery Wrigley, Governor Larry Hogan the other day talked about, and I've been saying this since the beginning because I have health professionals I know, this is not the flu. This is different. Can you explain as somebody who has to deal with people who do have the flu, and as you shared with your 80 days of COVID-19, explain the difference between this and the flu?
So the flu, I think, is a little more predictable. It usually runs its course. It can be rough. People are hospitalized for the flu. It can definitely be hard on the body. However, what we've noticed that differentiates COVID from the flu is that COVID, it waxes and wanes. You start to get better, and then, 3 days later you get worse, and then you start to get better, and then you start to get worse again. It's not just an uphill battle that once you reach that feeling of wellness, you're okay. One day you can feel fine, and the next day you feel terrible. Mm-hmm.
So is there one particular patient that you recall, or either the difficulty or something that was gratifying, if you will, from dealing with that patient, that experience?
I think probably one of the most challenging but rewarding patients I had was a patient that she was one of our first COVID-19 patients. It was back at, the beginning of April, I want to say. She was on our floor for a couple weeks, and she was just not recovering. She was an elder patient. She had a lot of other health issues going on, and she ended up actually going to hospice. And it was the first batch of COVID patients that were accepted into Gilchrist Hospice. And she was oriented, but she definitely had, bouts of confusion. Well, I ended up FaceTiming her family because they weren't allowed to come and see her. So I FaceTimed her family in and, stood in the room, and the family wanted to see me garb up, see what I had to do to take care of their mom. We, stood on FaceTime for probably 30 minutes. And when I tried to leave the room, they wouldn't let me because they said that I was part of their family now. And just getting to share experiences like that kind of made it worth it to me, even though they were challenging and they were, emotional at times.
Avery Wrigley, once again, it's very powerful. 80 days of COVID-19, starting on March 25th, and when you wrote that piece in June, and listening to your experiences, I want to thank you. We always talk to doctors and everything, but the nurses are truly the backbone of care in many ways for our patients. So thank you very much, Avery.
Yeah, thank you so much.
Thank you.
More in a moment.
Listen to WBAL on your smart speaker. Tell your device to play WBAL. C4 and Brian Neiman on WBAL News Radio 1090 and FM 101.5.
Brian Neiman, when it comes to nurses and the role they play in the whole continuum of healthcare, we see these TV shows, right, where, particularly in COVID-19 era, where the nurse is literally holding that, that device to communicate between the family and the patient, and they are the only human connection for a lot of these patients.
Yeah, it's one of the worst things that has been really a cornerstone of the COVID is that you don't have your support group with you because you can't bring people into the hospital. You can't be there. And there was a time where even when a woman was going in labor, she couldn't have her husband there. Luckily, some of that stuff has changed. Funerals, another thing, churches, things that you normally do together as a family when you are down and you need support, those family members can't be next to you. So, yeah, that makes a huge, huge difference.
I really do appreciate what hospitals, the nurses, the doctors, everybody have been doing through this. Now they're getting ready to get hit again severely. So we just have to watch their care, because without them, where will we be, Brian?
Yeah, I mean, it is all about studying, figuring out how to deal with this thing, the therapeutics, and luckily the vaccines look like they are really, really effective.
But how to get these doctors rest? They need rest, too, in order to. I don't want a tired doctor dealing with me. Thanks, Brian. Thanks, Jacob.
You have been listening to the C4 and Brian Neiman podcast. Send feedback to C4 on Twitter at C4 Show and Brian at Brian Neiman. Catch C4 and Brian live each weekday from 5:30 to 10 a.m. on WBAL News Radio 1090, FM 101.5, or stream anywhere on WBAL.com and the WBAL app.